Hello to all Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here today with me is our special guest, Dr. Rajeev Agarwal. And welcome, Rajeev. It's wonderful to have you here.
Oh, thank you. I'm so excited to be here. So excited.
Rajeev, you're one of our speakers for the upcoming Gold Tongue Tie Online Symposium of 2022, a two-day event packed full with presentations, and yours is one of them as well. And before we go a little bit into the presentation, first of all, I want to learn a little bit about your background. I know you're a pediatrician, but you're a very special one. On top of that, you have developed a very own style of practicing, and you are strongly supportive of natural ways of taking care of little ones. So tell us a little bit about it. Tell us about your journey and how did you come up with your own way of practicing? What led to that?
So, Kristen, thank you for the great introduction. I'm a pediatrician, as you said. I trained in med school from a med school in India, and did my residency in pediatrics from University of Texas in Galveston, and then went on to do a fellowship in nephrology, which is kidney diseases of children. After that, I had a little stint for about 7 years in working in general pediatrics in a very rural area. It's called the Eastern Shore of Virginia, a lovely, lovely place. That was the first time in my life I kind of slowed down a little bit. Prior to that, I was like, go, 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 just keep going, just keep going. So I realized there that general pediatrics is fascinating. It's absolutely fascinating. What we can do, the difference that we can make in children's lives, in the families' lives, is just like, it may be in a very short time, but huge differences can be made. I started reading a lot about Ayurveda, about started questioning, why do we do what do we do, and is this the best thing to do? I became a person who, rather than accepts everything, rather than a believer, I became a person who questions. I started questioning everything. The working in that community, I realized the rates of breastfeeding were relatively low. In fact, when I say relatively low, they were really low. And there were many migrant workers. It was a poor socioeconomic status community. And I saw moms who really didn't even think that they could breastfeed. I think they would have liked to, but there was no support in the system. For generations, they had not breastfed. They didn't know. They saw pregnancy as natural, as normal. However, delivery as natural and normal. However, breastfeeding was like, not right. And with what I know from my pediatric training, I realized that this was backwards. This was completely backwards. Breastfeeding lays the foundation for a healthy child and a mother. We all know that. There's been so much research on that. So I started thinking, why are these moms, how can we help them? Why are they not into breastfeeding? This seems so natural. It just seems like the right thing to do. And they agreed with that it's the right thing to do. They just didn't have the resources. And I just thought we need to do something about it. Didn't have that much support locally, though everybody on a philosophical basis agreed, yes, breastfeeding is great. We're going to do our best to promote it. But how are we going to do it? What is the plan? How are we going to put it in action? Was kind of lost. Then in the meantime, we moved to Phoenix, Arizona, and I've been here since 2004. Well, earlier in my practice, I kind of, it was not easy to set up a practice, and I kind of let that go. I said, okay, I'm just going to get situated. And then I had a kind of a life-changing event when a mom came to me who really wanted to breastfeed, she truly wanted to breastfeed, and the baby had an obvious tongue tie, and she told me that she expected me to do it. And I was, I've told this story several times. Many of the Gold speakers may have heard the story because it was a life-changing event. I did the tongue tie procedure, the frenectomy, under duress. I didn't want to do it because I thought I was not trained and I didn't know that it was going to help. Though no literature, no experience, but I did it. I did it because I believed that I wanted to help this mom. I wanted this mom to be able to breastfeed, and it was very easy. It was obvious to see, and this mom within 5 minutes or maybe less, but the baby on the breast, baby went on crazy on the breast. And yes, it was just like, it was, and I couldn't even believe myself. I was ready for some success. I was hoping for some success. I wasn't sure, but I wasn't ready for this extent of success. It just, I was literally as wide-eyed as this. I was like, what is happening here? What have I been missing? I've already been a pediatrician for almost 10 years. How many moms, I never even asked this question. I said, hey, feeding is going on well. You're on the growth curve. Life is good. Let's move on. That's all I did, right? Because that was my training. You want to make sure, follow the weights very closely on the weight curve, and life is good. How much of that is through breastfeeding and how much of that's through formula feeding? I never asked that question. That wasn't ingrained into me. This life-changing event, I started asking the question. And then I realized how moms have not been given the information. We as pediatricians have been told, oh, follow the growth curve and everything is good. But how? When do moms give up breastfeeding? Is it because, and how do they do that? Meaning, like, is it because of lack of knowledge, or they're having difficulties, or lack of support? I mean, of course, we have to work on it from many angles.
Yes.
Many angles. This is not a, flip the switch and it's done. We need this is a community change. This is a change of perception. This is a change of your focus in your practice. And I realized, being able to help is very empowering, even if it's to one human. It's very empowering. And then when you start seeing patterns and you see, wow, you know what? This can be replicated. I am in a unique situation in which I've had success. At that time, it was 100%. It was just one patient, right? And gradually, I started looking for it. I started asking the right questions. The word got out in the community. Hey, there's a guy who's doing this. There were some very supportive lactation consultants who helped me build up this practice. And I would say for about 10 years, this has been the focus of my life, in which I've been helping many dyads to breastfeed. Then, of course, coming the issue of speech issues, and I started noticing it, and I've had tremendous success with that also. So that's my journey in short. There've been lots of, as any journey, up and down, and I have been supported amazingly by my peers in the community. Some of them have been more challenging, and that's just as well, because once you're challenged, you do only better. That tells you got to improve. My moms have supported me like nobody else, because I always tell my mothers, you are the person who's on the receiving end, who has seen a change. You now owe it to other mothers to help them. I don't know whether educate. I don't know whether this is the perfect answer, but this is at least one of the answers. And this answer has worked for you. So at least talk about it, at least get the information out there, and then let the professionals evaluate. Let the professionals evaluate, and let's go from there. So we've had some amazing lactation consultants in the community who have helped me hone my process. Dr. Agarwal, this is working, this is not working. So, it has been a community effort. And now at this point in my own practice, that's truly all I do. I have lactation consultants in my practice. I have world-renowned Dr. Lori Jones in my practice, who has been a guiding light, who has been my mentor in my studies on breastfeeding. We have nurse practitioners who have given their life to this. And, we have come and developed a whole program. This is not just something, do a procedure and it's done. Oh, well, that's the end of it. Go and home and breastfeed, and and everything's gonna be everything will get better. It doesn't work like that. You need a program. You need support. You need the right diagnosis. You need the right information. And I'm really happy to say that over the 10, 14 years, so many Facebook groups, good, bad, ugly, all of it. But at least the information is out there. So many conferences. I mean, amazing conferences. There are so many other professionals who have joined me from all over the country, and we communicate, we learn from each other, because learning is an unending process. I feel like I've just scratched the surface.
Yes.
So,
Yes.
that's my journey, really.
That is
It
so
is.
much to learn still. And
Oh my Lord, yes.
you just mentioned it correctly. It's just like scratching the surface, and there's still more coming out. What you mentioned also
Yes.
with speech issues, that is
Yes.
something that's now,
Yes.
there's a bigger focus on that as well. And
Mhm.
you having this beautiful community of, breastfeeding professionals there helping you and getting the word out, the moms getting the work out as well, the word
Yes.
out as well, and then also educating other care professionals, other care providers like nurses, other physicians, because as you mentioned, it wasn't a focus in your practice in the beginning
Right.
because that was not part of your training originally,
Hmm.
right? That you
Hmm.
look for that the growth
Right.
curve, and that was it. And now you're looking completely different, at
Hmm.
at the whole diet, and you have a whole wonderful team working together. I mean,
Yes.
that's absolutely fascinating and wonderful. And if that can be replicated in other areas, in the nation and worldwide, that I think would be like the gold standard for everyone to have that support and the correct diagnosis, as you mentioned, and then building that team around it. Because as you said, you had this wonderful success with that one client, but sometimes I have to ask you, you probably also have seen that you did the frenectomy and it wasn't quite as successful as you had hoped. Have you seen this as well?
Oh yes, absolutely. I would say when I talk to the parents and talk about the procedure, because I think that is really important that they have all the information and they understand what's going into it. I would say we have 80 to maybe 90%, sometimes depending on the situation, 95% success. Is it 100%? Absolutely not.
Yeah.
This
Yeah.
is a multifactorial issue. This is not, as I said earlier, not just you do the upper tie, lip tie, you do the tongue tie, and the babies are going to breastfeed like crazy. No, it doesn't happen like that. There's associated body work that needs to happen. There's associated post-care, pre-care, and most importantly for the parents to understand, to know, to why am I saying what am I saying? What is this about? Because there is still a lot of hesitancy on part of general
Mhm.
pediatricians, family practitioners about how come this didn't happen like 20 years ago. Everybody was,
Yep.
how
Yeah.
come
Why
all
is
of a
this
sudden,
now?
why
Why
is
have
this now? I
is
mean,
this a fad? What is this? Yeah.
yes, yes, yes.
Right?
Is it
Yeah.
evolution happening or it's
Mhm.
devolution happening? All of a sudden, or
Yeah.
everybody has a tongue tie. Like, what
Yes.
is the deal?
Yes.
All
Yeah.
those questions, parents have those questions. I personally have those questions. I'm telling you,
Mhm.
I've become a person who questions more than has answers.
Right.
So it's really interesting. I have had many moms who have not been able to have as much success as I would like. That has always helped me in going back, looking at the whole clinical scenario,
Yeah.
evaluating my own process, my own procedure. What could we as a community have done better?
Mhm.
What,
Mhm.
as Rajeev Agarwal, as a provider, could have done better? What information did the mom not have? Was a lactation person involved or not
Right.
involved? I will tell you, having a lactation professional involved
Mhm.
pre and post is probably the most important, maybe that along with a good milk supply. Those two things I would say are the most important markers for success. If those
Mm.
two things are in place, I can almost presume that the success is going to be high. Now, of course, I want to make sure there is nothing else from a pediatric standpoint
Right.
going on.
Mhm.
I have had kids who come in with congestive heart failures and neuropathies and many other things, which a tongue tie is not going to take care of that.
Right. Obviously. Yeah.
But
Yeah.
those
Yeah.
that needs a very good baseline foundational pediatric assessment. So we make this as a diagnosis, like
Mhm.
every breastfeeding problem is a tongue tie. No, no.
Right.
Do an evaluation, a good, honest evaluation, discuss it with parents. And the chances are this may be one of the issues. And if you
Mhm.
can fix it, try to fix it.
Yes.
Um, if the mom has a good milk supply, I have a higher chance of getting the baby back on the breast. That's how I'm defining success for this second.
Right.
And of course, if a lactation consultant is involved, that's always amazing. So because
Yeah.
that's their specialty, I
Yeah.
always tell moms, if you have a neurological problem, I send you to peds neuro. You're
Right.
having a lactation problem, I'm going to send you to a lactation consultant, right?
That's
So
right.
that is so
Yes.
important. That is so
Yes.
important. So I think that's really important. The whole community comes together for success.
Comes together. Yeah.
Yes,
Yeah.
I think, yeah.
That's wonderful. And let's talk briefly about your presentation today. The presentation is titled Frenectomy, the Importance of Anticipatory Guidance and Post-Procedure Support. And you mentioned it already,
Sure.
how important that support is, right? But also the anticipatory guidance, because often, some parents think, oh, I do the frenectomy and that's done with. But there is post-care, post-procedural care, right? That needs to happen. And education is key here. So tell us a little bit about what we can look forward to in this presentation.
So this is, thank you for Gold for giving me this opportunity to present this, because this is truly the presentation after my heart. I've done, I don't know, hundreds of presentations on the procedure, and I enjoy it. No doubt. But what is really important in my mind is the anticipatory guidance. People need to understand, moms need to understand what they're getting into. What is a reasonable expectation? If the mother is not on the breast at all, is pumping and giving the baby only breast milk or only formula or whatever that may be, and that mom gets into 2 or 3 times onto the breast, I think that's success. Do you see what I'm saying?
Yeah.
It is all in the degree of success. This mom does not want to breastfeed or is not able to breastfeed during the day, but wants to do it at night when she's back from work. That is success. So you have to define success for that mother, and you don't define it. You ask, what is success for you? How, and that's one of my favorite questions to ask. Mom, what is it that you think you would like to get out of this procedure? How would you say, Dr. A, this procedure was successful for me? And it's going to be different for every mother. Right. Then we have to support that level of success to the mother. If you tell a mother, if you don't breastfeed all the way around, you are going to be unsuccessful. Do you know you've done way more harm than good, way more harm, because everybody's journey is different. You have to meet them where they are, and what is their goal, where they want to. So that is anticipatory guidance is based on defining their goals for themselves. Like, talk to them, ask them this question, have a good, frank discussion. Tell them that you are not a magician. You are in it with them. You are in it with them. I mean, I always tell mothers, I'm right here with you, for you. I'm going to help you. I'm going to hold your hand through this whole journey, because this is not an easy journey. Many of these mothers come in with severe postpartum depression enough that I have to send them to either a psychologist, sometimes even a psychiatrist, because they, in their mind, have decided that their motherhood is defined by their ability to breastfeed. Yeah. You have to disconnect the two. You have to say, you are a good mother any which way. You are a wonderful mother, the best mother this baby can be. And let's try to see how you can breastfeed or how you can feed. Every scenario over these years, Kristen, has been different for me. Yeah. And it is beautiful when you are able to make even the slightest difference in how the mother feels, how the baby feels, how this interaction goes. Yeah. The diet is important, the two of them. Then, of course, post is not easy either. When you have to do the exercises, pain control, moms are like petrified. And I'll tell you, very often, more than moms, dads are petrified. They're like, well, what's going to happen? Mom's already so upset. I'm going to have an upset mom and an upset baby. Oh, Lord, I can't handle it. So, you have to talk, talk about that. You have to be realistic. You've talked about ways to go through that period. What else do they need? Does the baby have a torticollis? Does the baby need body work? Which is very, very, very often the case. Yeah. So, this is a very finely tuned process, and it's a process. It's just not a procedure.
Right. It's a process. I love how you said that it's a process and not a procedure. And there is so many, it takes this community of,
Yes.
the parents, you as the physician, the IBCLC or
Oh,
lactation
yeah.
consultant, possibly body work,
Hmm.
so it takes kind of really a village to get together
It does.
and
It
provide the
does.
care
The
here.
doulas, the psychologists, the friends of the mothers,
Yes.
the mother-in-law, the father, everybody, everybody is involved, and that's how it should be. And that's how it should be. And that is when we get the most success.
Beautiful.
That's very important.
Wonderful. Well, Dr. Rajeev Agarwal, I am so happy that you were able to sit down with me here and talk about the upcoming presentation. It's been a pleasure talking to you.
Oh, thank you so much. This is my favorite thing to talk about. I can talk about hours. Sorry, I went on kind of crazy, but I truly enjoy this, and I feel very fortunate and blessed to be able to share my experience with everybody. And please send me the questions and send me your how you do it, because remember, I'm still learning. I'm here to share and maybe teach, maybe just a little bit, but also to learn. So thank you for giving this opportunity.
And viewers, you've heard this. You can put your comments in the comments underneath this video, of course, and your questions. And if you are interested in attending the Tongue Tie Symposium that is being held live on September 12th, and this is the day when Dr. Rajeev Agarwal's presentation will be live. We have 2 days on September 12th and September 13th. Both days are live, but everything is also recorded. So if somebody cannot be there at the live, we have the recordings available for you, and you can find out more information about all these presentations that we have for you for the Tongue Tie Symposium. You go to goldlearning.com. Thank you everyone for watching. Bye-bye everyone.